beginning, what is the importance of the breast biopsy or directly to be referred to the surgeon? We educate this organization, they educate people or the doctors about self-examination training, clinical breast examination of all patients, proper reference and training to cover to their role in education and private to be refer their patients to the private hospitals and major hospitals. Actually, we have now establishing another centers in Aden, in Hodeidah, and Taiz, and we have a plan to do mobile mammogram. Now we have 3 centers are now establishing and will be built. We have similar challenges with other countries about limited resources, limited lack or public sector Ministry of Health. They have no, their complete or cooperation between the government and non-governmental organization. Also, our human resource qualification and training. We have a limited number of radiologists. We have a limited number of oncosurgeon. We have a limited number of oncologists. Actually, I want to ask, we have to do like this activation of the regional breast cancer groups, regional breast cancer screening guidelines. We have no clear guidelines to whom we do screening and to whom we do mammogram. We have, I think, if we between our meetings, to put our regional guidelines about our breast cancer screening. Also, annual regular regional meetings for breast cancer. Thank you very much.
Thank you, Dr. About these guidelines of breast screening, I think now it is clear. These guidelines must be regional, depend on resources, depend on the supply. This is very important issue must be discussed. And not every guidelines applied in Saudi Arabia, applied in other country, in USA or in Canada. Not important to apply it in some countries. Must be every country select this guidelines. It depends on his resource. I think it's very important.
I know there is international guidelines, but I think in our region we see there is some different. We see our patients younger than the other regions. Also, the education for the people about we say guidelines. When I do mammogram or not mammogram. If we do mammogram only for patients who are 45 years old, what about the risky people? Okay. Also, we follow the same, but I think if we discuss between us the regions, if there is something different between Yemeni and Saudi and regional region than the other the international guidelines, if they have some different, and we can modify them.
I think Dr. Fatmi agrees with us. Must be localized the guidelines.
At the start of the screening pilot, we have we had two guidelines. But later on, we agreed that if we are going to have a national screening program, so we have to have a standardized guideline to be used by all the governorates. And for this, in collaboration with the UNFPA, we produced a guideline which is developed in 2010. Yeah, so yeah, especially to Oman. Yes, according to the availability of the services, the resources we have, and whether we have a trained manpower or not.
Dr. Fatma, I recognize that about when you are encounter the risk factors, the first one was ladies when she born a child after the age of 40. Do you think this is the standard or?
This is a standard according to the UNFPA consultant who helped in developing these guidelines. So yes.
This is one of the risks.
One of the risk factors.
I know, but usually we are يعني, in most references I found variations for this. As you said, it is above 40, but some of them said above 30. يعني, as a risk factor.
35, yeah.
يعني, so why you are saying 40? Does it mean that in your place this above 40 is a common thing?
Unfortunately, we don't have a study identifying the risk factors for breast cancer, but that is a future plan to have such research. Currently, we just use that it is agreed nationally to have the risk factor is to have a first child after 40 years old.
Okay. Any other questions?
About self-examination. يعني in Oman and Yemen, they concentrated on self-examination as a tool of screening. I think there is no evidence about self-examination. If you going back to the international references, they don't document self-examination as a tool of screening. Maybe we can putting it under early diagnosis, just to know female the early sign and symptoms of breast cancer. So they have to know their breast before and then to discover and to know what is the early sign and symptoms. But as tools like clinical examination and like Mamono, even the clinical examination, there is issue about it. Yeah. And for high risk factors, for high risk groups under 40 to make mammogram for them, as the doctor say, like early menarche, it is not as a high risk which increase the risk of breast cancer fourfold or more. And there is more high risk factors than it, like genetic factor, family history among first relative and second relative, and also radiation therapy when the female at early age between 10 and 30. And there is more, I astonish when you say early menarche, the female who have the first child 40 and above. We don't consider this at a very high risk, and to make screening before 40.
To answer the first part, actually, initially when we thought to have a screening program, we thought to have first to test whether it's feasible to start such a screening program, and because breast cancer itself was a taboo before 2004, where before the association of before the National Association of Cancer. The NGO, National Cancer Association, and when we start the CBE and BSE, we were part of the trial that was conducted in the Arab Governorate, which is led by UNFPA consultant, Prof. Miller, and Oman was one of these countries to have such trial based on the prerequisites for a screen, availability of prerequisites for a screening program. So yes, BSE is only used to increase the awareness, and mainly it is used that although you do the screening program, even if you do it once in your life, or if you do it at an intervals of 2 or 3 years, what about that period of these 2 years, which a lot of things can happen. So the BSE, teaching the lady the accurate method of performing BSE was essential, though, so that's why it was included in the screening modality. Regarding the risk factors were made again by the experts from IMRO region.
Dr. Fatma, you give comment or?
For me, another point?
I have.
Okay. So these risk factors are modified in the, during the evaluation of the program, and they are also susceptible to re-evaluation of the criteria for high risk. So yeah, we are still in the process of improving the screening program. It's not yet, this is the final phase of it. It's still under evaluation, monitoring and evaluation, continuous monitoring and evaluation of the program.
Dr. Fatma الملحمي, can you give us this very short?
I do believe, yes, it's right. I think not everything in the West we can apply in our region. We are in a conservative community, and it's right. We have to start with the ladies themselves. They have to know their bodies, and part of it, because most of our ladies, they don't like to be touched. They even resist the clinical examination, and believe me, after our own experience, they also resist the screening program. At least for me, after 10 years of experience with the ladies, that we have still to encourage ladies to do breast self-examination. And most of our patients who come with positive lesions, they come because they felt it or their partner felt it. So in our conservative communities, I think we have to encourage ladies to do self-breast examination. Thank you.
Thank you, Dr. Fatma. Thank you, Dr. Ahmed. I think, Dr. now the message to home must be we start the screening. Must be we start.
Screening.
Lead the details in the third or fourth step. Please, we start screening without coming in details.
Yeah, but we have to put in our mind that it should be a cost-effective screening program. Use all the available resources you have in the country. Doing something is better than doing nothing.
Thank you. Thank you.